Hello, I'm Bryan Sivak, and I'm the Chief Technology Officer and Entrepreneur in Residence for the Department of Health and Human Services. Here at the Department of Health and Human Services, my team and I have been working to change how government works and give people, both inside and outside government, the tools they need to solve some critical healthcare problems through experimentation and innovation. This past year, we made some great strides in changing the way government does business and in supporting the health data ecosystem. We have been busy this past year, and I'm going to highlight our top 10 accomplishments for 2012 in innovation and health data. This year, we launched the HHS Innovation Fellows Program. The program brings individuals inside and outside of government together to work on high-risk, high-reward projects. All of the 4 projects are addressing critical needs within the healthcare environment. One project is taking on the archaic process of the nation's organ transplant system, a system that, believe it or not, is currently administered with paper and pencil. Another is addressing states' needs for a shared IT infrastructure for determining Medicaid and Children's Health Insurance Program eligibility under the Affordable Care Act, a system that doesn't yet exist in states and that have Medicaid eligibility systems that are sometimes 20 years old. The third project is improving the process and rate at which quality measures are developed in HHS, a process that can sometimes take years. And the last of the Host Fellows projects focuses on finding a way to keep healthcare devices working in natural disasters, a project that is very relevant given the ongoing relief efforts in New Jersey and New York after Superstorm Sandy. Together, the Host and External Fellows will have the freedom to experiment, to try out new ideas and concepts, and to contribute to the improvement of health and health outcomes for millions of Americans. Next up, we launched our unprecedented 6th round of HHS Innovates, our internal program that recognizes innovative projects and individuals within the department. Over 6 rounds, we have seen innovations ranging from detecting coal dust explosibility in coal mines to an internal Craigslist for laboratory equipment. But this past year, we not only had another group of great submissions, but we discovered some insights on why people actually innovate at the department. We found that people innovate to, first, create a product or process that doesn't yet exist. Second, improve an existing product or process by making it more effective. And third, create a product or process that does not exist in the marketplace. When discussing the barriers that people encounter and reasons why others don't participate, the leading causes were internal doubts about the probability of success, finding sufficient time to dedicate to development, and a lack of financial resources. Using what we've learned through the 5 rounds of HHS Innovates, we are working to change the overall culture of the department to be more conducive to experimentation and innovation. At number 3, we launched an internal collaboration tool for individuals in the department to overcome barriers they are encountering in our highly siloed organizations. This tool is allowing people from all over the department to collaborate, reducing duplication of effort and resources. As we continue to roll it out, we are testing different hypotheses to see what drives adoption. Just last month, we tested this hypothesis: does a meaningful, compelling event draw people to this platform and engage them in this technology? The meaningful event we chose was around open season benefits, and the response was phenomenal. 744 people signed up and engaged on the network that day, with over 600 more people signing up the next day. The conversation is still going, and health benefit advisors who had not previously participated in the original event have jumped in and are monitoring engagement. In 2012, we continued to make great strides in making data publicly available and making already public data easier to access. In June, we launched healthdata.gov, which is a catalog of data resources and a one-stop shop for developers. Over 400 datasets and tools are available on healthdata.gov, including 32 application programming interfaces, or APIs, making the Department of Health and Human Services among the most advanced in the application of the White House's new policy on digital services. Now, in the same vein of data liberation, the Centers for Medicare and Medicaid Services launched the Qualified Entity Program. The program provides standardized extracts of Medicare claims data to what we call qualified entities to enable them to measure the performance of providers and suppliers. It requires that Medicare claim data be combined with claims from other sources, and reports generated from this data must then be made public. The program creates a system for providers to receive a single, actionable performance report covering all or most of their practice instead of multiple non-standard reports they currently receive. Already, 3 organizations have been selected to participate in this program: the Health Improvement Collaborative of Greater Cincinnati, the Kansas City Quality Improvement Consortium, and the Oregon Healthcare Quality Corporation. Expect much more from this program this year, including the first set of public reports. The next accomplishment on the list is the biggest health data event of the year, the Health Data Initiative Forum 3, or better known as the Health Data Palooza. This past year, the Health Data Palooza was bigger than ever, with over 1,500 attendees and more than 100 applications featured in apps demos, breakout sessions, and the Data and Apps Expo. The number of applications and services submitted for the Health Data Palooza National Competition was 244, up from just 21 in 2010. The majority of these utilized HHS data. Additionally, we heard from leaders in healthcare, technology, and government, including Senator Bill Frist, Dr. Atul Gawande, Dick Foster, Bob Kocher, and our own Secretary Kathleen Sebelius. We also had the launch of our first 5 health data affiliates, which brings me to number 7 on our top 10 list for 2012. Regional health data affiliates are a key part of our national infrastructure to expand the uses of health data. When first launched, 5 health data affiliates, Boston, Seattle, Cincinnati, Louisiana, and Denver, were announced. Since then, we have added 2 more affiliates in California and New York. Affiliates are closely connected with the Health Data Consortium and provide connectivity and communications to national-level health data activities and support local entrepreneurialism and innovation activities. Coming in at number 8 is the big year challenges, competitions, codeathons, and meetups had, all of which have played a huge part in the advancement of innovation in healthcare. In 2012, more than 30 events were held across the country, bringing together health officials, health systems leadership, investors, and developers. Codeathons and challenges, both publicly and privately sponsored, are the basis for about 20% of the new concepts, startup applications, and services that are emerging in the national competition. Coming in at number 9 is the explosion of consumer health applications. The marketplace for consumer applications for health, safety, and healthcare have made some great strides this year, ranging from smartphone applications to web applications and personal health devices. Some examples include, first, wellness. Specifically, the use of smartphones for tracking health and behavior to manage wellness and compliance with healthcare practices. Second, emergency preparedness. The Assistant Secretary for Preparedness and Response sponsored several challenge competitions that enable people to notify friends and family of their status during emergency situations using mobile phone systems and Facebook. An example is Be Ready, a new app which has proven a viable business model by marketing emergency supplies on its site. It's receiving rave reviews. And third, physician finder and health information services with geospatial mapping tools such as the U.S. News and World Report's Best Health Insurance Plans app and HealthGrades app, both of which are powered by HHS Open Data. In the next year, we anticipate even more in this space, mainly due to the last accomplishment of the year, the Blue Button Initiative. Blue Button is an easy way to download your personal health record, which originally started with the VA and is now available for Medicare recipients. In 2011, 38 million people were served in Medicare, all of which now have access to their personal health record via Blue Button. However, when people access Blue Button right now, they're given an ASCII text file. This file is static and it gives the users little flexibility in use. We understand that consumers want their personal health data at their fingertips, but they want it in a format that's useful, which is why in 2012 we started to work to make individuals' health data more useful through the Automate Blue Button initiative. My office, the Office of the National Coordinator for Health IT, and the Department of Veterans Affairs have launched the Automate Blue Button initiative. This initiative is developing standards to allow patients to privately and securely download their health information in a common, machine-readable format, as well as automate the exchange of that data from their healthcare providers to other third-party apps and services. Soon, you'll always be able to get the latest copy of your health data and route it to the app, service, and provider of your choice. Well, that's the list. Thanks for checking out our top 10 accomplishments for 2012. We anticipate greater things in 2013, and if you want to know what we think will be happening this year, check out our 2013 predictions video.